My name is Dr. Cara Rabin. I'm a family medicine physician at CU Medicine in Centennial, Colorado. I had to do something that involved interacting with people. I could not do a desk job. I would get bored, and also I'm quite talkative. Someone once told me I could make friends with a wall. So I like to talk to people, get to know people. In kind of middle and high school, I always liked science, but it actually didn't really come easy to me. I was more the kind of reader, writer type of person. But I have never been one to shy away from a challenge. So despite my parents actually telling me not to be a doctor because it was a really hard road and I could do other things, I decided, well, of course, that's what I would do. The majority of my patients come to me for chronic conditions such as helping them manage their hypertension, their diabetes, their high cholesterol. A lot of patients, especially now, I will say since COVID, come to me with more mental health complaints, anxiety and depression. And a lot of what we do and treat is psychological conditions that don't quite need a psychiatrist yet, but we can help manage the patient and stabilize them. I also think people don't know that we do a lot of women's health. I love seeing women at all aspects of their healthcare needs and doing contraception, such as if they need a pap smear, an IUD, a Nexplanon, we do all of that. I also really like seeing patients, again, at all ages. So seeing kids, seeing adolescents. Sometimes in adolescence, you're kind of at that weird stage where you don't really want to see a pediatrician, but you're not necessarily going to see an internal medicine doctor till you're 18 or 21. So I think coming and seeing me is a nice medium. I will say I trained in New York City and actually recently moved here from Manhattan. And in New York, I did a lot of gender-affirming care. So I really like working with the trans population and helping them as well. I really like to meet them where they're at and where they're ready. And I like to kind of take things one at a time. So often, let's say it's something like diabetes, I like to give patients one goal that they can do at a time, one thing to work towards. And ideally, if they can get in and make the time, do close follow-up with them to help them get to their goals. I will say telehealth and doing the video visits, as much as I prefer to see patients in person, has sometimes helped being able to see patients more frequently. And I also just really like to get to know them, get to know their families and their backstory, so I can try to understand, again, where they're coming from, why they might believe certain things, want to take certain medicine, why to not take certain medicine. That helps me understand if I understand more about them as a person and not just their medical problems. I love getting to know people and getting to know their life story. And I think, again, that's why I wanted to be a family medicine doctor, is that you can actually see them throughout their life and get to know everything about their life. So I think I really value that patients trust me. Like, to me, sometimes I'm still in awe that people want to come to me and tell me what's bothering them and trust me to try to help them with that. And I really value that immensely. I actually think it's a great honor because it's hard to trust people, and certain members of the community might have more difficulty for good reason trusting physicians, and I hope that I can be someone that they can open up to.